So first of all شفتوا الابيسود مال هاي منو شافها كلها مال highlights and radiology. طينا bone lesions, vertebral bone lesions benign,
benign most commonly عندنا hemangioma.
hemangioma, osteoblastoma, aneurysmal bone cyst. Okay, Hozan, what's the sign of plasmacytoma? Typical sign شو يسموها؟ شو تطلع؟ اي بالسيتي بالامراي بكل شيء. ها ميني برين ساين اكزاكتلي. شنو الدفرنس بين البلازماسايتوما والمالتيبل مايلوما؟ single level. It's good. Next week episode غير شكل. لا مال الاسبوع الجاي تختلف، كلها حركات وفيديوهات وشغلات شويه متعوب عليها مال الاسبوع الجاي. Anyway, so let's start. This is a 26-year-old female patient complaining of low back pain. Long duration. Good. Yeah. Speak as you scroll. This is what? T2. فاتسات لو مو فاتسات؟ يعني هذا الشحم كله هذا شلون لونه؟ هذا فات سبرات. فاتسات كورونا لو ساجيتال لو اكزيال لو اوبليك لو شنو؟ كورونال تي 2 فاتسات. اوكي good. Pelvic area and sacroiliac joints showing
high signal.
لازم تقولين هاي تي 2 signal.
High T2 signal on bilaterally on both iliac bones, the inferior border of both iliac bones.
اوكي مو هذا نفسه. شوفي بالساكروإلياك جوينت بالذات especially in sacroiliac joint you say high signal intensity involving the iliac aspect of right sacroiliac joint or iliac aspect of sacroiliac joint bilaterally or both iliac and sacral aspects of right SI joint or left SI joint or both SI joint. So you have to decide which aspect and you have to decide whether it's symmetrical or asymmetrical or bilateral or unilateral. So start from the beginning.
High signal, high T2 signal intensity.
Good.
On the iliac side.
Okay.
Of both.
Of the iliac aspect.
Of iliac aspect bilateral.
تمام.
Bilateral.
Good. Of the iliac aspect of both SI joints. زين. بعد كمل.
Symmetrical.
Bilateral symmetrical. Exactly. Good. خلينا نشوف باقي السيكونسات ترى بعد عندكم سيكونسات. This is
Low signal on T1.
T1 axial showing low signal intensity, confirming it is an edema.
Yes.
يعني it's an inflammation. Good.
Features goes with sacroiliac. It's bilateral. But we have bilateral.
Wait. leave the mouse. Leave the mouse. Now, let's continue. انت ما كملتي مو هاي مشكلة. You have to see everything. I'm giving you information. You have to
Don't hurry up.
make the full use of it. كملي. هذا localizer يا تركي. شنو هذا السيكونس؟ This is T2 sagittal without facet. Without facet. ما يشبه facet.
High signals are
ها showing.
high signals are the corners.
Okay. At the corners of the vertebral
Vertebral bodies.
bodies. Okay. What else? خلينا نشوف دقيقة. Wait. هذا شفناه. زين. These signals are what on? What's this sequence?
T1.
T1. Sagittal. Without or with facet?
Without.
Without facet. Good. So these signals are what in T1?
Also high.
High in T1 and high in T2. Okay. So let's see in the axial. Do we have any significant finding? Let's say not that much. Okay. Do we have any other sequences? No. Good. So to summarize our findings.
Bilateral symmetrical sacroiliitis
Okay.
with high signal intensity on the corners of vertebral body on both T1 and T2.
Okay. شو يسموها هاي الهاي signal intensity on the corners of the vertebral body؟ هذه ساين لها اسم يسموها إما shiny corner sign or Romanov's lesion. Romanov's lesion. Plus bilateral symmetrical sacroiliitis in a 28-year-old female patient equals ankylosing spondylitis. Okay? And that's how you diagnose ankylosing spondylitis on an MRI.
Early sign. Shiny border, early sign.
Yeah, one of the early signs of ankylosing spondylitis.
Not
That,
because sacroiliac, يعني.
sorry? It's early process. It's starting. Maybe if you wait for it, it will change.
Like osteitis,
So,
condensed ileum.
so osteitis condensus ilii, this is a radiological, like CT or X-ray, not on MRI. Okay? Good. Thank you. يلا next. سلطة؟ اكو غيرك؟ يلا احسن ما نذيع بالاسماء خليها سكتة. خلينا نشوف ايش عندنا. من القادم يا هلا. عليكم السلام ورحمة الله وبركاته. زين. شوية انتي سكن ثيرد خطية وليك. لا سهل ثلاثة. This is a 41-old male patient. Abdominal distension, pain, abnormal ultrasound, referred for MRI. هي ما تسكت يعني ما تصير. هي مال سكند يعني. لكل حادث حديث، أبو السكند إلى سكند، أبو الثيرد إلى ثيرد، أبو الفورث إلى فورث. First of all, what's the sequence? Diamond, speak. Don't stay quiet. MRI of abdomen. This sequence is what?
T1.
This is T1.
T2 without.
This is T2 without fat sat. Coronal, axial, sagittal, coronal. Showing.
There is. خلينا نشوف دكتور كل السيكونس هذا بعدين خلينا نحكيه. There is a high signal. There is a round, well-defined mass with intermediate high and low signal intensity.
Okay.
In the liver.
Okay.
Segment.
زين شوفي other sequence ليش ستي بواحد وبعدين you have a lot of sequences.
This is T2 also. With fat cell, not suppressed.
The lesion is not suppressed on T2 fat sat,
Yes.
so it's not a fat containing. Okay.
دكتور أنا أعرف يعني هذا
Huh.
hydatid.
So you think this is a hydatid cyst?
Yes.
Okay.
Looks like a hydatid cyst.
How it looks like a hydatid cyst?
The sign يعني
شنو الساين؟
not water lily. Linguini sign.
linguini sign ممكن تسميها, water lily sign ممكن تسميها, which is basically daughter cysts.
Yes.
Daughter cysts inside the
Liver.
original cyst. Okay. Now, good approach. Let's see. If we go to, what's this? T1 with contrasts. Is it enhancing?
Not enhancing.
So, hydatid usually enhance or does not enhance?
Does not enhance.
the wall.
The wall enhances, the contents does not enhance. Why the wall enhances? Can anyone tell me? Cyst هو it's a parasite. ليش الوول ياخذ enhancement والcyst ما ياخذ enhancement? Inflammatory reaction. ليش هو يسوي inflammation؟ ها. Why the wall of hydatid cyst usually enhance? Content does not enhance. Okay, مفهوم. بس الوول ليش enhance? There is a capsule, fibrous tissue, surrounds the cyst. So the capsule, which is the fibrous tissue, belongs to the human body, while the cyst, it belongs to the parasite. So the fibrous capsule, which is part of the human body, of the host, enhances, while the cyst, it's a foreign material, it does not enhance. Okay? My question is, from where or where is this cyst? Where is it located?
Segment 4B or 6.
So you say it's in the liver.
Yes.
Okay. What are the signs that helps you to decide this is in the liver? Okay, let's see here. Wait. Where راح? Let's see here. What are the signs that help you to decide this is a lesion arising from the liver?
Claw sign.
Claw sign. Where is the claw sign?
This.
The partial volume, you are at the top of the lesion. Is there a claw sign here? No close lining. Okay, what else? Is it surrounded by liver parenchyma on all aspects?
No.
No.
Just anterior.
زين. Let me شوية نقربها أكثر. خلينا نسوي هيك. Just a second. Maybe we can get more details like that. Where is it? So this is the lesion and where is it here? And this is the lesion. So where does it? We don't have a full close line. It's not surrounded by liver on all aspects. بعد شدنا size that helps to decide it's from the liver. Oh, a close line, acute angle. We said it's not, or not obviously close line, just in one part. Okay, so here, does it look like it's arising from the liver or from outside the liver? Let me just a second. Let's focus it a little bit. Is it from or from outside the liver? It looks like from outside the liver, صح? Even the surrounding is less than 50% liver. If you look carefully, it's less than 50% surrounded by the liver. So if it's from outside the liver, from where?
Suprarenal.
This is an adrenal gland hydatid cyst. Okay, it's very, let's see on the, maybe on the, I think T2 or T1 it will be more obvious. So this is the left adrenal, and where's the right? You can see this part present, and here the anterior limb, it's replaced by a hydatid cyst. Okay, so ما عندنا liver hydatid قبل، لازم بها لوف. Thank you. منو finalist? هيك ماشي. Let's see. شنو ليش؟ لا يا معوج، شو تسوي؟ دقيقة. شو ما نسوي؟ طفيت الراديانت وطفيت اصبر. خلي الاقي لك كيس. زين. ثلاثة 6. ثلاثة 6. Okay. This is an elderly patient presented with cough, shortness of breath, and he was tired. NG tube was inserted, and on a chest X-ray they saw this shadow here pushing the trachea to the left side. So CT scan was ordered. تفضل. طبعا هذا this is axial CT scan of the chest with or without contrast. هذا without. طبعا اكو بعدين with. Tell me, what do you see?
Right side aortic arch.
So there is a right-sided aortic arch, which is very interesting considering he's something like maybe 70 years old, and he was not known to have right-sided aortic arch. زين نشوف لنا الكونتراست. يمكن ناخذ more details. So the mass that they saw on the X-ray is basically just a right-sided aortic arch. It's a congenital normal variant. And that's not normal, but it's a congenital variant. Good. بس صحيح؟ تعبان الرجال تعبان. يعني هذا he has the aortic arch from birth. Why he's tired now? Do you think this is a collection? This is a zygous. A zygous crossing. بس لأنه ال right side aortic arch يبين بهالشكل. زين. Where else? ها؟ As you like. كل الصور عندك و do whatever you like. تقدر إذا تريد تسوي كورونال تسوي ساجيتال تسوي لونج ويندو بون ويندو كيفك. It's your patient. منا نسوي كورونا هذه فوق هاي. Does anybody see anything abnormal that might help explain why this patient is in pain or, I don't know, tired, feeling bad? Okay. Diffuse gastric wall thickening. موافق أنت لو لا؟ Atherosclerotic is an old guy. It's expected يعني.
بس ابو براح شوف البرانشنج بعد ما الاورطه نورمال.
شنو هو؟ شوفه بالاكزيال ارجع الاكزيال. شلون تغير ويندو؟ شو تريد؟ لونج ويندو؟ هاي لونج ويندو. So the lungs is basically good or bad or what? Some grounded glass, yeah. Could be due to some mild infection, aspiration, gravitational effect, whatever. Then. So we have nothing significant in the lung window. Let's see the bone window. Do we have any abnormality with bone window? يعني هذا الحجي نقول له سلامتك ما بيك شيء عندك رايت سايد ايرتيك ارش صار له 70 سنه روح لهلك جايبيه اثنين شايليه يعني. اوكي يعني عمره 70 سنه شويه كاردياك شدو الله اكبر سهله. زين خلينا نرجع على وين السوفت تشو ويندو. هاي السوفت تشو. ايش قالوا جماعتك؟ So, this is the stomach. Where is the stomach? Where is the stomach? Is this a normal gastric wall? Is diffuse thickening of the gastric wall. صح؟ هذا ايش قد يمكن 2 سنتيمتر thick؟ هذا كله gastric wall هذا. It's all thick. هاي. What else? كأنه شنو؟ اي شنو هذا؟ This is an NG tube. Nasogastric tube. And it's perforating the wall of the stomach, which is a very rare presentation of NG tube. It's going somehow through the wall of the stomach. يا معود. سوي coronal. اوقف. So possibly our explanation would be possibly diffuse gastric lymphoma causing weakening of the wall of the stomach resulting in easy وين واصل الانجي تيوب شوفه نشوف الى السيروزا. So lymphoma is a pliable tumor. Pliable يعني soft. It does not displace, it infiltrates. لأنه it's soft. يعني diffuse small bowel lymphoma ما يجي intestinal obstruction. يجي بجاي upset onset intermittent diarrhea و bloody stool وما أدري شنو بس ما يجي bowel obstruction. diffuse mediastinal lymphoma ما تسوي SVC obstruction. إذا تشوف SVC obstruction احتمالية الليمفوما تقل. ممكن ثايموما ما ثايموما ميتاستاسيس هذه سوالف. الليمفوما دائما soft. طبعا مو دائما يعني أغلب الأحيان. Linitis plastica means solid adenocarcinoma, which I don't think. لا liver looks good. اي هو واصل للسيروزا. باقي له يزرف في السيروزا وفول بلون perforation. لا ما عنده. Why you commit yourself to esophageal thickening or not? Do an endoscopy, take a biopsy from the gastric mucosa and see the esophagus on the way. Well, I would not comment on it, صراحة. I would not comment on the esophagus because the NG tube is there, so it's difficult to judge. See? يعني ممكن هذا areas of retained fluid. Maybe. I don't know. Okay? يعني here looks good. Esophagus. ممكن. زين. Next. Hello. واحد صار له هواية ما جاينا. لازم نستغل وجوده. ما ندري بعد شو وقت يجي مرتي له. Yeah. Just a second. ثلاثة خمسة 355 هاي نسميها يعني كيس للعزيز. This is a 40-year-old female patient. The question from this case, you tell me what's her complaint. انت تقولي لي شنو الشيف كومبلين. هاي كلها شو اسمه سيرفيات او سكاوتس او وات ايفر. هاي منا تنزلين. هذا first one. What's the sequence? Coronal, flare with fat cell.
40 years old female.
Okay,
This is the brain MRI, coronal flare with fat cell sections.
good.
Showing multiple lesions, mostly involving the infraterritorial aspect of the brain.
زين ليش ما تشوفين التي 2 والتي 1 قبل لا
Yes.
احسن ما يطلع لك شفت شيء بعدين يخربط هاي كلها وتعيدين من الاول.
This is T2
Mhm.
without fat cells.
T2 without fat sat, axial section. نفس الرأي لو تغير.
Multiple cortical-based hypointense lesions
Good.
involving the
Multiple cortical based يعني extra axial. T2 hypointense lesions. ايش فيها؟
involving supra-infraterritorial
supra infratentorial صح كانوا بس infra. اوكي. هسه شو نسوي next؟ نفس الشيء على تي 1. شوف التي 1. زين. What does it look like with T1?
almost
ISO. وراها شو تسوي؟
T1 plus contrast. This is T2
T2 sagittal.
Yes.
Showing
Same findings.
almost the same findings, nothing new. Okay. Put the contrast. Okay.
Multiple ring enhancing lesions.
كلها ring enhancing؟
No, some of them show solid enhancement.
Solid enhancement.
Some of them shows full ring
Hey.
enhancement, complete ring enhancement.
Good.
This one was not obvious. The one was just close to the brainstem.
Okay.
It's more.
This one is enhancing and close to the brain still.
Yes.
What else? What else? زين خلينا نشوف الكورونا والله. So what's your primary differential diagnosis?
Middle-aged female, multiple supra-infraterritorial solid ring enhancing lesions, mostly metastasis as first differential diagnosis.
Metastasis is your first diagnosis. Second diagnosis.
Abscesses, multiple
دقيقة. اصبروا لا تصيروا اسبوع. No?
abscesses.
Multiple abscesses. What is against metastasis or abscesses? دقيقة يا شباب. What's against metastasis or abscesses?
The
Location.
Extra axial.
All of them, they are innumerable. All of them extra axial. This is very not usual. What else? Against and abscesses. There is no surrounding edema. None. Zero edema. Third, against. If it's metastasis or abscesses, what's the presentation? Right. So you tell me the complaint. What will be the complaint? So something non-specific. Can be seizure, can be weakness. So I will not ask you for something non-specific. لازم really هاي عندها كذا. صح؟ زين. يعني من السؤال ممكن نستنتج الجواب. So it's not abscess. It's not metastasis. What else? تفرجينها على رسم الراديولوجي؟ زين. يعني هذه هنت طيب. ادري عرفتي. هسه قاعدة تقولي لي تجيب كوبي. ها؟ نعرف ولا ما نعرف؟ شنو يعني؟ اوكي. اوكي. cerebral pontine angle lesion. زين. So, what do you think is going on? There are multiple meningeal vividly enhancing lesion with no surrounding edema, relatively mild mass effect compared to the number and size. Okay, so suggesting these are multiple meningiomas or meningiomatosis. Okay, indicating that this patient is likely to have what? Neurofibromatosis type 2. Neurofibromatosis type 2. What are the findings in neurofibromatosis type 2? Meningiomas, schwannomas, and epididymomas. يعني ليش يسمونه neurofibromatosis؟ ماكو neurofibromatosis. neurofibromatosis. انت قلتي meningioma وشوانوما وابندايموما. ما قلنا neurofibroma. ليش يسمونه neurofibromatosis؟ It's a misnomer. Why misnomer? Because they thought it was a central type of a neurofibromatosis. بعدين عرفوا انه ما بي neurofibroma. فظل الاسم. زين. Neurofibromatosis type 2. What is a criteria that is diagnostic of the neurofibromatosis type 2? يعني إذا شفيها خلاص هذا neurofibromatosis. أي شوانومس؟ شباب ترى هيك راح نسأل. زين؟ ها؟ زين. خلينا ندور على بايلاترال شوانومس. وين نشوفه؟ بس وين نشوفهم؟ بالكورونا ولا بالساجيتال ولا بالاكزيال ولا بالتي 1 ولا بالتي 2 ولا بالفلير؟ المفروض تي 2 بالاكزيال. هذا التي 2. سوي اوكي خلينا نسوي زوم. لحظة. نسوي زوم على السي بي انجل في سبيل شنو؟ نحاول نشوف إذا أكو شيء ولا لا. أوكي. زين. I agree. Let's go to here. To the T1 post contrast. And let's try to see. Do we have anything?
Yes.
What do we have?
This is
Look carefully.
I see that there is some extent to the internal acoustic.
What's this? Hi, شنو هاي?
Within
Within
the internal.
the internal canal.
Yes.
Enhancing.
Enhanced.
Okay. What is this? Within the internal canal. Enhancing. Confirming. This is
Bilateral acoustic.
bilateral acoustic schwannoma. What's the chief complaint of the patient?
Deafness.
Deafness. شفتوا شلون؟ Thank you very much. See you next week.